Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on injuries and injury treatments and injury prevention in sports and exercise so that you can stay healthy and perform your best. One of the most common surgeries that I do as an orthopedic surgeon is an ACL reconstruction. Basically, an athlete or an active person maybe lands from a jump awkwardly, or maybe she's running and playing a sport like soccer, plants her foot to turn, feels a pop in her knee, falls to the ground. She's blown out her knee. She's basically torn her ACL. And the surgery for that is ACL reconstruction. Now, it's an awful injury. There's no question. It's painful. Your knee is swollen and it's stiff. It's really, really a big deal. Obviously, you're out of sports for a while. But yes, we can treat it surgically. And yes, we can get you back to whatever sport and whatever exercise you like to do. But that's not easy. Even with a surgery, there's a long rehab process. And I want to talk about one component of that rehab process today, and that is getting range of motion back. So that's what we're going to talk about in today's Ask Dr. Geyer video. Lisa asks, is it true for an 18-year-old that if you don't get 0 degrees or full knee extension by 12 weeks after ACL surgery, you'll never get full extension even with aggressive physical therapy? If it's true, does that mean you'll never run as fast as you did before your injury? Well, it's a terrific question, and that seems kind of strange that you would struggle to get knee range of motion back. But when you do an ACL surgery and you're basically making a new ligament in the center of the knee, and you do it arthroscopically and you drill tunnels in the bone and you put the graft up into the knee, it's a big deal. You're doing a lot of trauma inside that knee, and your knee reacts by getting inflamed. It's already swollen from all the fluid that the surgeon runs through it at the time of the surgery. But then you've got to protect the graft, so we're not doing just unrestricted activities right off the bat. A lot of times we'll use a brace after surgery, but it is very important that we work on range of motion right away. And the most important motion that we work to get back is knee extension, basically getting the knee all the way flat. That is so important. And so I really push that, and most sports medicine orthopedic surgeons really push that in the first few days after surgery. And certainly we want to get full knee extension back. I like to have it completely, the patient can easily get it all the way flat by no later than 4 weeks, maybe 6 weeks at the most. And generally with bending the knee flexion, I like to get at least to about 90 degrees by about 4 weeks or maybe 6 weeks, and then you can usually get the rest of it. Now, some people scar down faster than others, and they struggle because of pain, and it's really tough to get motion back, and that's where working with a physical therapist is so important. Working with a physical therapist after an ACL reconstruction is so important anyway, there's no question, but it's definitely important to get range of motion back. That's why I'll start physical therapy for a patient after ACL surgery 4 or 5 days after surgery, even before they see me as a follow-up visit. But if you're struggling to get it back, there are some devices that you can use that can help straighten the knee and that can help bend it. But to be fair, it's a lot of work on the part of you as a patient, and then obviously the physical therapist. Yes, if you struggle to get knee bending back, what we call knee flexion, we can sometimes manipulate it, or yes, even we can go in arthroscopically and scope the knee and clean out scar tissue. That doesn't typically work real well for full extension. That's why it is so important to get it back very, very quickly. And one of the mistakes that I see patients make sometimes is they'll sit on the couch, or maybe they'll sleep with their knee bent. Maybe they'll put pillows under their knee so it keeps their knee bent, maybe 10, 15 degrees, and then it gets really hard to get it all the way flat. That's why I'm a big fan of the brace locked-in extension early on, including sleeping. We all sleep with our knees bent if we don't have a brace on it, so that brace helps keep your knee all the way straight. But if there's any point that I can make, it's that you really want to get range of motion, especially full extension back really quickly. Sometimes there's some restrictions set by the doctor on specific range of motion, but we almost always want full extension back right away. If you lack 5, 10 degrees, yes, it can be tricky. You might have a very subtle problem with your gait. It may just be a little different on one side than the other. Yeah, it may even affect your running stride. Again, sometimes there's surgical options, but it can be really tricky. So this is much more a problem or a situation that we need to basically prevent rather than treat after it happens. So work really hard to get full knee extension back very, very quickly after ACL surgery. Now, have you undergone ACL surgery, and was it a challenge for you to get your knee motion back? What did you have to do to get your knee all the way straight and bent all the way? Did you work with a physical therapist? I'd love to hear your experiences. So below this video, please share your experiences. I'd love to hear how you went through it. Maybe that can help other people going through the same injury and the same surgery. If you have friends or family members that have recently suffered an ACL injury, torn their ACL, and now need surgery, please share this video with them. I really hope that I can help them in some way. If you like videos like this and want more information on injuries and injury treatments and injury prevention in sports and exercise, subscribe to my video channel. I record 1 or 2 of these videos every single week, and I'd love to deliver those directly to you. And last, there's so many resources that I create on ways to stay healthy and perform your best, whatever your sport or whatever your exercise, and I only share them with my email list. So go to my website, drdavidgeyer.com, click at the very top of the page. You'll see you get a free ebook, The Year of the Healthy Athlete, and like I said, I share a number of resources completely free, and if you sign up, I'll deliver those on a fairly regular basis right to you. I look forward to communicating with you this way. I really hope that this video was helpful. Remember, if you have had an ACL surgery, I would love to hear your rehab experiences, but most of all, thank you so much for watching. I really appreciate it, and I look forward to seeing you right here next time.